Hey guys, in this video, I'll try to simplify the differences between anterior and posterior dislocations of hip joint. This is the most frequently tested topic in both Neetpg and inicet, and usually in the GTs that we give also, this question frequently appears, like they give you something regarding the posterior dislocation in the question and ask you the false statement or true statement out of it. And we usually tend to confuse because these are like closely related things, right? So I got a mnemonic for you to remember the differences between anterior and posterior dislocation. So don't skip the video, watch it till the end. We also have a question to solve at the end. Firstly, let me display that question for you, which is a 25-year-old mason sustains a fall from the roof, and they given everything like flexion, abduction, external rotation, lengthening, everything like whatever the information they want to reveal, they have revealed, and they are asking you about the false statement about the suspected diagnosis. Now that you have gone through the question, please try to answer this. Like freeze one option in your mind as an answer, and then later we'll come and see if it is right or not. So this is a PDF of ortho pearls or treasures or whatever we say, the important things. So out of that I have selected this section for today, which is anterior and posterior dislocation of the hip joint. Right? So here comes the mnemonic part, which is the letter S. So whole table will be simplified with one mnemonic, not even mnemonic, one letter, that is S. So let us see how. In between anterior and posterior dislocation, where do you find the letter S? It is in posterior dislocation, right? So posterior dislocation is most common. Post is most common. So prevalence is done, right? That means opposite thing should happen in anterior, that is less common. Coming to type of injury, it is seen in dashboard injury, which has a letter S in it, whereas deceleration injury or fall from height does not have a letter S, which goes to anterior dislocation of hip joint. Dashboard injury is for posterior dislocation of the hip joint. Coming to the attitude of the limb, in anterior dislocation it is Faber, whereas in posterior dislocation it is Fader. This is the most important point. They usually ask you the question about the attitude of the limb, and we also have a video regarding this attitude of the limb in our YouTube channel, guys. So that is a very short video, like from 5 to 6 minutes it will be, and it helps you remember all the different attitudes of the limb that you come across in your ortho. And all the important questions from Neetpg and inicet are also covered, so you don't need to concise it. I have concised it already for you. So whatever the attitudes of the limb that you need to remember will be in that video. I'll link it up at the end of this YouTube video so that you can find that link easily, and it will be provided in the description also below this video. Coming to length of the limb, it is shortened, that is S, in posterior dislocation, whereas lengthened in anterior dislocation. Coming to radiological findings, that is whatever you see on the X-ray or whatever the radiological method that you use, is femoral head is displaced superiorly, that is S, and laterally in the posterior dislocation, whereas it should be opposite, that is inferior dislocation, that is inferior to the acetabulum in the anterior dislocation. That means the femoral head can be felt in the groin region. Coming to the appearance of the femoral head, it will be smaller, that is S, in the posterior dislocation, whereas larger in the anterior dislocation. Coming to the length of the limb which is affected, so lesser trochanter, length of the limb, it is shortened in posterior and lengthened in anterior dislocation, whereas coming to the lesser trochanter appearance, lesser trochanter is less visualized. That means not visualized in posterior dislocation. When it is less visualized, here it should be more prominent, right? So in the anterior dislocation, lesser trochanter is more prominent, whereas in posterior dislocation, it is less prominent or not prominent. Coming to the nerve injured, S for S again comes, that is sciatic nerve, whereas here it is femoral nerve. Femoral vessels are affected in the anterior dislocation of the hip joint. Here are the radiographic images of both dislocations. Let me explain this. The first X-ray, which is showing the inferiorly dislocated femoral head. So let me highlight it for you. So this is the acetabular zone, right? Usually the femoral head should be here, whereas it is getting inferiorly dislocated in this X-ray. Look at the femoral head position here. So it is here. This is the femoral head. One second. Yeah, this is the femoral head, which is inferiorly dislocated, so that you can feel it in the groin, right? This is the X-ray regarding anterior dislocation of the hip joint. Look at here, this is also inferiorly dislocated. And when you look at the attitude, flexion, abduction and external rotation, right? So it is moving away. So flexion, abduction and external rotation. Whereas coming to the second image, here the limb is towards inside, that is flexion, adduction and internal rotation. And when you look, try to look at the lesser trochanter here, which is less prominent, that is not prominent. You cannot make out the lesser trochanter here. See, this is the normal position where you can see the lesser trochanter. This is the normal limb. Whereas here, lesser trochanter you cannot make out. In this one, lesser trochanter is even more prominent, right? This is anterior dislocation. So this is the X-ray images of the both dislocations, which is anterior and posterior dislocation of the hip joint. Now shall we solve this question? So previously we have read the question, right, which is about Faber and lengthening. These are the important clinches from this question, and they are asking us about the false statement. Let us go through all the four options now. First option, femoral head can be felt in the groin. This is true statement because it is inferiorly dislocated to the acetabulum. So it can be felt in the groin, right? Inferiorly dislocated groin. So first statement is true regarding anterior dislocation of the hip joint. Coming to the second option, which is femoral vessels may be affected. Yes, this is true because sciatic is affected in posterior dislocation, whereas femoral is affected in the anterior dislocation. Coming to third option, which is about Stimson's gravity method can be used for the treatment. Let us put this option aside because as of now we don't know about this Stimson's gravity method. But coming to the fourth option, femoral head appears smaller than the unaffected side in the radiograph. So unaffected side is nothing but normal side, right? So femoral head appears smaller. Smaller S is for posterior, isn't it? So this statement is pointing towards posterior dislocation of the hip. So this is the false statement regarding the anterior dislocation. So this will be our answer now. So option D is the answer. Even though we don't know about this option C, we can still answer these kind of questions if we know the other three options perfectly. So Stimson's gravity method can be used for the treatment is the new point learned from this question. So the answer is option D, that is smaller than unaffected side in the radiograph is seen in the posterior dislocation of the hip, whereas in the anterior dislocation, femoral head appears larger. So this completes the beautiful table, the radiographic images and the question, how to solve the question, how to approach towards the options in this short video. If you like this video, please let me know in the comment section, and if you want me to make other tables from this PDF easier, please let me know in the comment section. Thank you.